The next few videos, I will be sharing of examples of how I feel I have been medically blacklisted. As per Google, medical blacklisting is when medical and chronically ill patients may be blacklisted due to the involvement of their medical cases. Also, a patient who has previously sued a doctor, like me, may be medically blacklisted by other doctors because of the lawsuit. While not ethical, medical blacklisting does occur. I'm going to share in the next few videos a number of these events that happened to me, and I'll let you decide if blacklisting is real and if you think that's what happened to me in this case. So my C-section, nightmare C-section from hell happened in March 2011. Within a couple of years, I had a colonoscopy at a private clinic. The doctor almost gave up because he was having trouble working through my colon and could not get all the way through. I ended up having to return because there was thickening of the folds and marked tursicity, or twisting, I guess is what they call it, of the sigmoid and descending colon. So I had to return so they could do it via the other end because they couldn't get through. After the results of that colonoscopy, he referred me to another gastroenterologist who had hospital privileges. When I consulted with him, he said, and I quote, "Obstetrics got you into this mess so they can deal with it," unquote. So he referred me to an OBGYN at his hospital. After imaging, they realized that my fallopian tubes were infected. I had had my tubes tied, or I think it's called a tubal ligation now, during my nightmare C-section. This doctor who removed them afterwards said that they were infected and that it would have happened pre-C-section, and I wouldn't have even known about it except for the fact that there's pathology results from the C-section that show that there was no infection. But that's just like a minor thing in the scheme of everything that happens. So they did a laparoscopic surgery. It was scheduled both with the gynecologist to remove the fallopian tubes and with a gastroenterologist to check the bowels and find out why I was having this rectal bleeding that coincided with my periods. Once I awoke in recovery, the OBGYN said she removed the fallopian tubes and a few adhesions and that everything looked great. I obviously asked, what about the bowels? She said she didn't check them because she didn't want to make things worse. Great reason to do a surgery. I asked about the gastroenterologist who was booked in on the surgery, and she said he didn't show up, and when I asked why, she shrugged. That's what I got. That's why the doctor didn't show up to the surgery of something that 13 years later I'm still suffering for. Last week I just had another colonoscopy and they might have actually found what's going on. But 13 years is a long time for me and my family to struggle through this. Then she told me that my OBGYN who did the C-section to begin with didn't mean to do this to me and was a good person. I now know they work together at other hospitals, and I think they actually might have done residency training together, and that both hospitals share obstetric residents, meaning the residents who disemboweled me after my C-sections could have been in the very same operating room at a completely different hospital. As far as I'm concerned, when it comes to informed consent, that's something as a patient I'd like to know. I had to return to the private clinic to see the gastroenterologist, who was not happy, would not answer why he didn't show up for surgery, did the colonoscopy he was told to do, and then wrote in the report that everything was great. I ended up again in a merge with rectal bleeding. From what I guess was bowel endometriosis, as the bleeding started 2 days before my period. CAT scan again showed bowel wall thickening, not consistent with diverticulitis, and requested direct visualization, meaning to go in and do a colonoscopy so they can actually see what's causing the bleeding. Although during colonoscopy, 95% of cases of endometriosis are missed unless they're actively bleeding while you do the colonoscopy. And it was very clear it's endometriosis. I explained I just had one and that the results showed absolutely nothing. Everything was great. That interested them because We've known through previous colonoscopies that I have moderate diverticuli, which are like little caves on the inside of your bowel that if food or something gets stuck in, then they can get infected. And since that C-section, I've had many cases of diverticulitis where they've gotten infected, but it doesn't compare to endometriosis pain at all. And the report made no mention of these, which concerned the doctors. So they made him repeat it. Well, made us repeat it, because not only did he have to repeat it, but I had to go through the whole colonoscopy process again, which I've probably done 20 times in the last 10 years. Just as the sedation was kicking in, he says to me, I'm not doing the whole colonoscopy. This is one of the many, many, many examples, and I do have them in emails documented so that I can back up everything I've said. I've had lawyers look at it. This is just one of the very first, I guess it's the very first time I was medically blacklisted, because at the time I didn't even know that there was such a thing. I didn't even recognize it. And now some of the other things that I've gone through that I will share can show a pattern. That is not what's right in Canadian healthcare. As Canadians, we deserve better. We should have no-fault healthcare. To sue a doctor, I don't know if anybody's watched the episode W5, I think it's called Stacked Odds, explains why it's almost impossible to sue a doctor for medical malpractice in Canada, even in a case like mine where there's obvious what happened and obvious the consequences that I live with every day. And not just me, it's about my family, like what my kids have had to witness. So I appreciate you watching the video. I'll continue to share, and hopefully I can bring awareness to this. Thanks.